Welcome to Adapting Class, and thank you for deciding to watch this video. I get an email about concept, how to master them, how to use them to answer the questions. What should you look for on the NCLEX? So I created this mini assessment. This is high yield facts, but straightforward. I took straightforward information to create a question to tell you that the concept is right in front of you. You take the concept and you move with it. When you see the question, you apply. So these are 40 questions. I will be a little bit fast, but I will give you all the critical questions that you need to answer questions. And you think about it, the way I'm going to approach it. Stop the video, listen. The questions sometimes get harder as we go forward, but this is the key. If you want to watch this video, take note on the way I'm trying to approach the question and analyze the topic. First question, as usual, prioritization 101 is designed to get you going and to scare you, but don't be scared. You got to be sharp. That is the key for prioritization. What is the issue? And next is carrying forward. Assign client. The next you first see the client with what? Atrial fibrillation on labetalol. Cardiac monitoring indicating irregular rhythm. Do you think you need to intervene in this patient? If you have a second, be sharp. Pericarditis with the blood pressure of what? 140 over 115. Do you think you need to intervene? Pericarditis with pneumonia with elevated white count and a crackus at long basis. COPD with palpitation after receiving Abudro. Go for each one of them and see if it's indicated. If it's expected, you move on. If not, you have to be sharp, deal with the breathing, electrolyte shock, sepsis, airway, neurological problem, and pain. Pain that is going to cost your life. Therefore, if you have AFib, I expect you to have irregular heart rhythm. And you being treated with labetalol, which is providing rate control. Ignore it. Pericarditis with the blood pressure of this 140 over 115. As you can see, it does not look like there is a pulse pressure. Every time they give me a pericarditis patient, I want to know if they have tamponade. If they give you chest pain, that is relieved by leaning forward. Don't worry about it. But if you give you signs and symptoms of tamponade, that is your key. 140 and 115, the difference between them is 25. That is the pulse pressure. What should be the original pulse pressure is 30 or 25% of the 140. So 25% of 140, right? So basically 25 over 100 times 140, which will give you close to like 35, right? 35. This is what the pulse pressure should be. But what do we have? We have 25. That means the pulse pressure is decreased, narrow pulse pressure. That is indicating cardiac tamponade. This is bad. You have pneumonia. Expect your white count to go up and you to have some fluid, crackles in the lung base. Ignore it. COPD, palpitation. If I give you Abudro, it's an expected finding. Therefore, what do you do? Ignore all the expected and pick your pericarditis, who is getting tamponade, leading to narrow pulse pressure. That is the key concept. Same thing. Which assessment finding will be most concerning? Which one you think is concerning? You have to be sharp. A client is 36 weeks gestation, has a blood pressure of this 160 over 100 and 2 plus proteinuria. That's like preeclampsia. It looks like it's getting to severe preeclampsia. Therefore, which assessment finding is concerning? Plus 2 period edema is not concerning. It's the leg edema. Blood glucose of 100 is not concerning. Respiratory rate of 10 is decreased, right? This is decreased. But compliant of what? Blurred vision, that means there's a neurological manifestation of the hypertension. This can lead to seizure and stroke, and you die. Blurred vision is your priority. Forget about the respiratory rate of 10 because there's no signs and symptoms of respiratory distress. That is gone. Which assessment finding require immediate intervention? A client with type 1 diabetes has been vomiting for 24 hours. Type 1 is your key. That is the bars rate. 24 hours is your bars rate. What do you expect? Vomiting, 24 hours, dehydration for type 1 diabetes patient. What are you worried about? DKA. Which of these answers indicate DKA? Glucose of 180 does not indicate DKA. Fruity breath order, that is acidosis. Complaint of what? Test is that's dehydration. Potassium of 4 is normal. Therefore, who has diabetic ketoacidosis? Fruity breath order is indication of acidosis. Therefore, that's your answer. What should the nurse do first? Same thing, prioritization. I uploaded the prioritization first to calm you down. Then we go to the content. A newborn has been born with what? Heart rate of what? 90 beats per minute. What should the nurse do first? This require a content. If you don't know, listen carefully. When a newborn heart rate is 110 to 160, anything less than 100 is not good. It's a bradycardia. Therefore, this kid with a heart rate of 90 is bradycardia. That means the lung is the main problem. For kids, they're going into respiratory failure rather than cardiac failure. So if you see heart rate of 90, this is the result of respiratory failure. Therefore, you should provide respiratory support. Which of these answer choice indicate respiratory support? Chest compression is not respiratory support, it's for cardiac. Reassessment 5 minutes later is not good. Give them positive pressure ventilation is the best answer. Administering of oxygen through nasal cannula is not enough. The next thing is if the heart rate go below 60, yeah, you have to intubate them. You still have to provide positive pressure ventilation, and then wait for at least 30 seconds to a minute. If it doesn't resolve, then you start chest compression. So chest compression is indicated when a heart rate is less than 60. So for this guy, ventilation is the best answer. You can see the reason here, but this, if you need a content, check out Dr. NCLEX regarding neonatal resuscitation. This is also content. The nurse should match each medication to mechanism of action. Which way? What is the question? A nurse has attended staff education program on pharmacology for diabetes. This is a short pharmacology of diabetes and a mechanism of what? Action. Mechanism of action. So you know this medication, canagliflozin, right? Metformin and glipizide and acarbose. All these medication, they have the way of working. They have specific mechanism of action. You have to know a little bit about it to be able to educate them. Canagliflozin is now a new medication that can help with heart failure, can help with renal failure, can help with diabetes, and it can help with weight loss. How does it do that? It leads to loss of glucose and water. This is why you lose weight. So that's the right answer. Metformin, what it does is it decreases glucose production in the liver. Glipizide, it increases insulin production from the pancreas, and acarbose it leads to slow absorption of glucose, and this is what you're going to have here. So content here being applied. Which prescription the nurse should anticipate from the healthcare provider? A nurse is assessing a client in the emergency department. The client has a end-stage renal kidney disease and has missed several dialysis treatment. EKG show peak T wave. Which prescription should you expect? Test taking strategy, look at the way I'm going to approach it, anticipate medication, peak T wave, end stage dialysis, miss several appointment. That means your K is going to be high. That's why you have K. Peak T wave is a EKG finding. When you have cardiac manifestation of hyperkalemia, you should stabilize the heart. All other answers, you ignore it. Spironolactone is going to increase the potassium. Enalapril is going to increase potassium. Our potassium is already high. That's why we have peak T wave. Polyestyrene sulfate is taken orally or enema to get rid of the potassium, but it takes a long time. Therefore, stabilize the heart. Calcium gluconate is your best science choice. Next question. Which priority action should the nurse take to manage the situation and prevent further infection? Select or apply. A client with what? Central venous catheter develop signs of what? Signs of bloodstream infection, which infection with including fever and chills. A client with central venous catheter develops signs of bloodstream infection, including fever and chills. What priority action should the nurse take to manage this situation and prevent further infection? In straightforward, simple form, patient has infection of a central line. What would you do? The doctor need to know about it. You got to obtain blood culture. Applying antiseptic ointment to the catheter is not going to help. This is a blood infection. Discontinuing the central line is not going to hurt. It's going to delay management because we have to give the patient antibiotic. You have to wait for the culture to be able to know if the line is infected. Administer antibiotic as ordered after obtaining culture is the right answer. Which action should the nurse implement to prevent the spread of infection? Select and apply. A nurse is caring for a client with Clostridium difficile. The infectious control. Go to the basement. What do you need to know? Infectious control. This is a contact precaution. What do you need for contact precaution? You wash your hands with soap and water, specifically for C. diff. Use alcohol-based hand sanitizer before and after client contact. No, you wash your hand. That's the best answer. Place the client in the private room with contact precaution. Wear gloves and gown when entering the client's room. Yes. Ensure use sterile technique for all procedures in the client's room. Not all procedures. Only few procedures you should use sterile technique. If sterile technique is required. Which recommendation should the nurse include? Select or apply. A nurse is providing education to parents of a child with cystic fibrosis. What is the concept of cystic fibrosis? One word, high calorie. They need a high calorie, high protein, high sodium, okay, low glucose diet, provide enzymes, and then daily exercise. Exercise to improve your lung, a lot of pancreatic enzyme. You need a high sodium, high protein, high calorie diet. Which of the following are signs of dehydration in an infant? You know dehydration. You lost a lot of fluid, so you show signs of dehydration, right? Sanking fontanelle, no brainer. Your urine output is going to go down. You're not going to have excessive tear because you don't have water anywhere. You're going to have tachycardia. Your mucous membrane will be dry. Which complication should the nurse monitor for? What complication? What is the key? A nurse is assessing a client in labor who has what? Epidural. So look at what I'm going to do. This is how sometimes you can make the question easy. You say epidural complication. So this is specifically for epidural. It causes respiratory depression, urinary retention, hypotension, and pruritus. It does not cause tachycardia directly because if you decrease your pressure, you're going to have reflex tachycardia. That is not a direct stimulation of epidural. Therefore, we will leave that one alone. Which intervention should the nurse perform first for a client with shortness of breath? Think about it. You're sitting there, prioritization A101. Sitting there, shortness of breath. I can help with your lung, do something better. Unless there's oxygen there, unless you're giving the patient oxygen, I'm going to raise your head up. Ordering ABG is not going to help the patient. Elevating the head of the bed, help with the patient. Checking pulses, does not matter. The question said, patient has shortness of breath. Notifying the healthcare provider, you're wasting time. Which of these clients should the nurse see first after change of shift? Client with asthma with respiratory rate of 20. I don't see any respiratory distress here. A client with chest tube reporting new onset of chest pain. If you have chest tube, you should not have any new chest pain. It may probably develop tamponade or the chest tube is not working. And if the chest tube is not working, the reason why it was put in is to drain fluid to prevent pneumothorax. Therefore, probably you have new pneumothorax. Let's look at the answer choices. Client with wound infection with the temperature of 100. Well, if you have wound infected, you have fever. Client with blood pressure of this report dizzy. Well, it may be orthostatic, but with this new chest, I'm worried about it. Which task is appropriate to delegate to LPN? I call it MMR most. Assess a new client with pneumonia. Assessment by the RN. Develop a teaching plan for a diabetic patient. Teaching performed by the RN. They can reinforce the teaching, right? Administration of oral medication. They can take care of most medication. This is appropriate. Evaluating the effectiveness of pain. They are not involved. The nurse will assess, I call it evaluate, assess, and treat. Which intervention the nurse should prioritize? And nurse is developing a care plan for a client with borderline personality disorder. For psych, look at the name of the medication, come up with the diagnosis based on your content, and you look at the answer choice. They're going to just interpretate what you know. What is borderline? They split. They do bad cap and good cap. Therefore, they will manipulate everybody. What are you going to do? Set boundaries. Do you see set boundaries there? Excellent. They are not dependent. You should not encourage social interaction. Is wrong because it does not answer the question related to borderline personality. Therefore, the best answer is clear boundaries as your priority. What is the priority in this intervention? A client with major depression disorder reports lack of energy and appetite. Look at it. He has depression. He said, I have less energy and appetite. Which of the following priority intervention is negated, right? Which of the priority next, which of the, what is the priority next intervention? So which one you want to give it? Encourage outdoor activity, provide frequent small meal, encourage increased sleep, and discuss feeling of guilt. What do you think? The patient told you that I lack energy and poor appetite. Of course, I can discuss the feeling of guilt, but it does not answer the question. At the same time, it's a depressive patient. What do you want to do? Always provide physical need. It's a psychiatric mental health question. Physical need can be provided by small frequent meal, and that will help with the energy and the poor appetite. Which intervention is appropriate? A client with schizophrenia is experiencing auditory hallucination. He can hear things. Which of this is appropriate? Encouraging social isolation is not the best answer. Use a calm matter of fact approach. This will allow um, therapeutic communication and be more supportive of you. Confront the hallucination. You should never argue. Avoid discussing the hallucination. You should find the content of auditory hallucination. So, using a calm matter of fact approach, they will tell you the content. A client with schizophrenia and cystic fibrosis is admitted with the respiratory distress. What is the priority intervention? Look at the bars way. Cystic fibrosis, respiratory distress. The patient is already in respiratory distress. So attack that problem. This is why I'm doing this video. Attack that problem. You know we will do chest physiotherapy. You know we may need antibiotic. You know they may need fluid, not to restrict, but is now in respiratory distress. We give them oxygen. That's all. Which statement indicate a need for further teaching? A nurse is educating parents on sudden infant death syndrome. Which of this indicate further teaching? We will place the baby on the back. Back is good, not front. We will keep the crib free of toys. This will prevent choking. We will put our baby on the soft, no, hard mattress. We will avoid smoking around the baby. Excellent. So hard mattress. What finding indicate immediate intervention is needed? And next, assess a client with crop. Therefore, which of these indicate what? Immediate intervention is needed. Barking cough, stridor, fever, and mild wheezing. Look at it. Crop, you're going to have a stridor, you're going to have barking cough, you may have fever and a little bit of wheezing. But the stridor is not at rest. Stridor is when you're crying or you're doing activity. At rest means airway compromised. What is the priority next action? A nurse cares for a postpartum client who report heavy bleeding and large clot. So he's bleeding. What is your priority? You know, mostly is the first thing that will come to your mind is the uterus, probably urine anthony, is the number one cause of postpartum hemorrhage. Therefore, what do you want to do? Massage, massage, massage. It will take a while for Pitocin to work. At the same time, whenever you see a question, it says, what do you want to do? Look at the options. If you, the nurse, can do the thing without needing an order, that is your priority. Massaging does not require an order from the doctor. Which assessment finding require immediate intervention? A client with heart failure is prescribed digoxin. Digoxin, what is the prioritization? You know it. Heart rate less than 60. This one is 76. Potassium, hypokalemia is a bad thing. Hyperkalemia is a bad thing. So these are the things you should know. So blood pressure is normal and calcium is normal. Lifestyle modification can help manage hypertension. Decrease intake of sodium. Increasing consumption does not do that. Follow a low-fat diet. Increase activity is good, and reduce stress are all good. Which steps should the nurse include? Select or apply. A nurse is teaching the client with asthma about proper use of inhaler. What is the way to use inhaler? What is the proper use? Shake the inhaler before use. Hold your breath for 10 seconds. You should not exhale forcefully. Use the inhaler while laying down is not indicated. Rinse your mouth after using steroid. You can also use your mouth after using ipratropium. It's also anticholinergic. Which of the following is a priority action? A client taking metformin report nausea and fatigue. That's the key. Metformin, nausea, fatigue is lactic acidosis. So what do you want to do? Evaluate them. What is the priority assessment? A nurse is preparing to administer morphine to a client who has pain 9 out of 10. Morphine is a respiratory depressant, central nervous system depressant. Therefore, pain level assessing it is not going to help you. Heart rate is not going to help you. Respiratory rate is the best way to assess the patient before giving them morphine. What should the nurse do first? A client receiving vancomycin report ringing in their ear. This is not um, Redman syndrome. You get vancomycin and you are ringing in your ear, hearing loss. Stop the infusion. Let the doctor know. Assessing for hearing loss is not good. You want to prevent it. I don't want them to have hearing loss. Administer antihistamine is not Redman syndrome. Slowing down the infusion is not Redman syndrome. Which of the following is the correct injection technique for subcutaneous insulin administration? The nurse is preparing to administer insulin to a client with diabetes. You inject 45 or 90, depending on how your weight, right? If you have higher BMI, 90, lower BMI, 45. You should rotate the site. You should never aspirate or massage and use insulin syringe. Which statement would the nurse expect to find? Or which symptoms should the nurse expect to find? Select or apply. And this is assessing the client with newly diagnosed hypothyroidism. Key concept, hypothyroidism, everything is down except your weight. Everything is down except your weight. So your weight will go up. You have cold intolerance. Brady is down. Constipation is down. Weight is up. BMI of 40 is weight. Which intervention should be prioritized? And then a client has a new diagnosis of acute pancreatitis. The most important thing about acute pancreatitis is airway management, checking for bleeding, and two, and three, pain management. Because if they have pain, they'll do better. If no pain, it's going to be a problem for them. So high protein diet, administering analgesic, position the client flat, encourage the client to ambulate. Flat is not good. Right now, they cannot ambulate. And then pain management is the priority. So which finding should the next report immediately in a client with suspected bowel obstruction? If you have bowel obstruction, what is the problem? There's an expected finding. If this is the colon, this is the no, this is the stomach, this is the bowel. If there's obstruction here, or if there's obstruction here, the area on top of the bowel will be hyperactive in bowel sign. You have abdominal distension. You may pass a little bit of gas, but if you have sudden decrease in your abdominal pain, it's considered a priority. The nurse should see you. Which next assessment findings suggest early respiratory failure and next care for a client with COPD. Oxygen saturation of 94 is normal for COPD. They may have productive cough, they may have cyanosis because of chronic hypoxia, but if you have increased agitation, that means air anger. What is the priority next action? And next cares for a client in the post-anesthesia care unit who is post-thyroidectomy and report numbness, tingling around the mouth. This is hypokalemia from thyroidectomy. Give them calcium. Request checking your calcium level. Assessing for deep tendon reflex. You don't need any more physical exams. Giving them magnesium is not going to help them right now. There's no antidote. This is no antidote for hyperkalemia. Provide oxygen by face mask. They don't need oxygen. They need their calcium to be given so we can check calcium level. The nurse should teach the client to monitor for which side effect. A client with Parkinson's disease is prescribed carbidopa, levodopa. This medication you need to know. It changes your urine different color, orange, yellow, orthostatic, and dyskinesia is the side effect, therefore orthostatic. And this is assessing a client for stroke or Bell palsy. Which of the following findings are consistent with stroke or Bell palsy? Stroke will have a slurred speech. Stroke will have asymmetrical smile. Stroke will have severe headache. Stroke will have pronator drift. Stroke does not have upper respiratory infection. Leg weakness is all stroke. The palsy will have slurred speech. We have asymmetrical smile. Will now have headache. Will not have pronator drift. Will have recent upper respiratory infection, and the leg, nothing is going to be affected. Which dietary instruction will be the most appropriate? And it's care for a client with cirrhosis. The liver hates protein, so low protein is good. The liver hates sodium. Low sodium is good because it prevents what? Um, Fluid retention, and is the most important. Even though low protein is okay, it's not the priority. This is the best way. Low sodium is the most important. Which food should the nurse recommend to support bone health? Select or apply. And as a client with osteoporosis, ask the nurse about dietary changes. You need calcium, you need a vitamin D and sunlight. Yogurt, sardine, and broccoli are your favorite calcium source. Which condition should the nurse expect? A pregnant client in a third trimester reports sudden onset of sharp abdominal pain, board-like. That's like peritonitis. Which of those represent as peritonitis? Preterm labor does not do that. Abruption does. Previa painless. Pre-eclampsia has nothing to do with it. Which Which is the priority nursing action? A client 36 week at a blood pressure of just proteinuria and report headache. What would you do? Do you give the patient methadone? First, you figure out what the patient have. They have what look like severe preeclampsia, and then what do you want to do? Give them control their blood pressure with methadone, give them some sedative, prepare for emergency delivery, and give them magnesium. Magnesium will slow whatever is going down before you can even take them to surgery. If you take them to surgery with all the upper failing, it's not going to help. So magnesium first to take care of it. Thank you for watching. I hope you gained something. Best of luck. And after, if you need more, check out, apply, and click on adapt and click or join our demand or our crash course or the YouTube membership where you get all of this video with the membership. Take care and good luck in your exams. Bye.